I'm Darlene. I'm the nurse practitioner here at Optimum Health. Wellness Decoded is our podcast that we're doing, and so we appreciate you being on this, Carlota. And we're going to cut out as much as the private information as you want. Okay.
Okay, gotcha.
Okay. All right. So starting back on that discussion of hormones, you've only been on progesterone a few times in your life, but you're not on it right now, right?
Correct. Yes.
And you've never been on estrogen. Okay. And when was the last time you had a period?
2020, November of 2020.
Okay. So you are fully full-blown menopause. So
Full
in
blown.
good. In our blood draws that we do, we still are going to check all of that, FSH and LH, to see where you are. But then we're going to check progesterone, estrogen, testosterone, DHEA. We're going to make sure that all of your hormones are balanced. We know for sure that you're going to be deficient in two of those, which is going to be estrogen and progesterone, because that's typical of postmenopause. When you are deficient in those, the one reason why even if you're fully postmenopause for years, I want to bring you back up to a normal level. And let me explain the reason why. Being at a normal level, when you're way down here right now, you're going to age faster. Think of estrogen as the moisturizer of your body. It's going to cause issues with ligaments, tendons, skin, vaginal vault's going to be all dry. All that stuff is going to be one of like probably the biggest issue, because when you dry out, your bones tend to start to dry out too, and you end up with osteopenia or osteoporosis. Have you have you ever gotten a DEXA scan?
Yes.
And
It's
was it
not good. No, not good.
okay? Was it osteoporosis?
No, but I'm close. Like it was dense. What?
Osteopenia.
Maybe. Yeah, it wasn't good.
Okay. So that's
To
the
tell
other
you,
thing.
I've had a horrible doctor. I went to a doctor 6 months ago to get all this stuff. That's why I do know about PCOS, and they just dropped me off. They did not, they just didn't do anything. They had the blood results. They had the results. They didn't tell me. I had to find out for myself. So
You had to call them and ask for the labs.
yeah, and then they had things in there that the doctor didn't call to tell me, like, "Hey, this is going on." So I've had a really bad taste in my mouth for medical help lately, and being busy, and it's just like I don't want to talk to these people. So I'm happy that we're talking. Trust me, yes. So I don't know what it said, but I mean, as far as exactly in your language, but I know
Mhm.
it wasn't good.
Okay. I'm pretty sure that would have been osteopenia, because if it was osteoporosis, they would have probably put you on a medication. Did they put you on a medication?
No, they didn't treat me at all, and there was things to treat.
Okay. So
So
that is the number one reason why I want you to be on hormones.
okay.
Right? Because that's going to help build up that bone again. Okay. Have you noticed any bone or joint pain?
Oh
Anything?
yeah. I getting out of bed, sometimes walking is like my knees, and I already have bad knees anyways because I had surgery. Yeah, I mean, oh for sure.
Okay, perfect. In that case, that's where the estrogen is going to come in to kind of start lubricating those joints and ligaments and tendons again. Now, tell me about your other symptoms. Any issues with like insomnia,
Oh yeah,
anxiety, stress?
insomnia big time. Stress not so much, but insomnia. I do know that my testosterone level was like 700.
Okay, so that's interesting. That means you're still doing really well with your testosterone, which
Yeah,
is
it
good.
was high.
Yeah.
and,
We
and everything else wasn't. Yeah.
we don't want you to be that high. You weren't on anything, right?
No, I mean, it's literally whatever the range was, like 15 to, 80 or whatever. I don't know what the range, but it was something like that. And I was in 700s. It's like way out there.
So interesting that you're still doing that and at such a high rate. So, are you having any acne, hair loss, acne, anything like that?
Acne, but I definitely have facial acne and my hair. I don't know. I'd been dyeing it blonde, so that I wasn't sure which way it was, but definitely I'm not used to seeing hair, leaving me.
Yeah.
And I have, yeah.
Okay. So the thing about the high testosterone that is more important than the hair, the acne, all of that is anger. Do you have anger issues?
I can if I get angry, I get angry. I'm not angry every day. I don't feel like constantly, on tilt. But if I get angry, yes, I get angry.
Okay. Um, Sometimes we can take a particular medication. Did they give you anything for that? Like
They didn't treat
spironolactone?
me at all.
Why? Why would you not treat that?
Oh, like at all.
Okay.
They
Okay.
sent me to the get all the tests done, and then they just blew me off after that, even though they had
Weird.
results to talk to me about. They didn't.
Weird. Okay, so for sure, we're gonna put you on something called spironolactone to kind of bring that down. If you can send me those labs, that would be great.
Okay.
Or just totally redraw your labs. We can send you a lab rec, and you can go to the closest lab.
I mean, whatever you feel.
Okay.
I can get those lab results. They're probably a few months old, but I mean, they're going to tell you a lot.
It's good to
So,
match them. I want to do labs since it's been a few months then, but it's good to have them so I can kind of like see what your change is.
okay.
So spironolactone is a really good medication to naturally bring down that testosterone, but also there could be other reasons. So the reason why I do a full functional panel is because I want to see how your ferritin levels are. When your testosterone's crazy high, sometimes your iron levels will be crazy high. Are you on any medications?
Just I'm on a prescription like antacid.
Okay, like
Um,
omeprazole?
it might be.
Okay.
I don't take it all the time at all, but
Okay.
I do have it for in when I'm really in need. I'm not in need all the time, but there's yeah.
And
Outside
that is the
that,
very best
mm,
way to take that, Carlota. If you take omeprazole on a daily basis, it lines the stomach with, what we call proton pump inhibitors that don't allow you to absorb your nutrients.
right.
So be careful with that, okay?
Yeah,
Do
yeah,
it
that's why I don't
when
do
you
it
need
every
it.
day, 'cause you told me that before.
Oh, good, good.
Yeah, yeah, I
Yeah.
listen to you.
You're fine. Okay. And then, so with the omeprazole, we'll talk about that when you come back with your labs, because I want to see if there's anything affecting your nutrients, your minerals, your vitamins, because we'll check all of that too. So, you're not taking a vitamin D, I'm assuming?
No, and I need to. I need that. But obviously, I don't know which one to take because most vitamin Ds are just garbage, and you know that. And again, they didn't help me with that either. So,
So, I'll send you a link. Did they say you were low on your vitamin D on
yeah, I
their
think so.
labs?
I'm pretty sure. Yeah.
Yeah. I'll send you a link. We're going to recheck that again as well.
Okay.
I like this particular one. It's on Amazon, so it'll be easy for you to
Oh,
purchase.
good. Okay.
Vitamin D. And we'll make sure you get that started because there are some simple things you can do before you even draw your blood. And these are the super important things. Now that you told me how high your testosterone is, we got to bring it down because it's causing a lot of other issues. Okay. Are kind of like hidden. And we'll see what that is when your labs come back. There's a few other things that we're going to check. It's going to be your CBC and CMP. So we're going to check your liver function, your kidney function, or spleen, your heart. We're going to check an inflammatory marker to make sure you don't have any inflammation around your heart because people who have inflammation around their heart tend to develop something called congestive heart failure. So we'll
Mhm.
look at that. Do you have any inflammation in your ankles?
Probably. I mean, do you mean do they swell once in
Do
a
they
while
swell
type of thing? Yeah,
like on
they
your
swell a little
socks?
bit.
Do the socks leave an indentation?
Sometimes, yeah.
Okay. So we'll look at that one. We'll do a CRP on that. And then we will check B12D. We're going to check ferritin, which is the iron that works in the body, but also if the iron gets too high, that's what's going to settle in your organs and cause damage. Have you ever had any issues with
Not to my knowledge.
okay. Have you ever had any issues with liver?
Not to my knowledge.
Okay. Any other conditions that you can tell me that you may have had in the past? So we can decide if we want to add anything to your labs.
Well, I don't have my left fallopian tube and ovary, right? So
Okay.
that I had that removed when I was 39. So I don't know how much issues that's caused or whatever. I've had, I have stomach digestive issues. Um, I have for a long time, probably just because I think it started with stress. I don't know,
Okay.
but I've had, issues with that.
Then
I have cognitive issues sometimes. Like at one point, I was losing my keys from the bedroom to the kitchen. Like just
that
stupid
could be
stuff.
a good fat HDL related issue when we don't have as much good fats that we're taking in, like extra virgin olive oil, coconut oil, almonds, avocados, all that. Then we don't protect our synapses in our brain because the synapses are wrapped in good fat called
Okay.
myelination. So, we'll talk about that if it comes back low too, and put you on a
Okay.
fish oil or something like that.
Okay.
We'll also look at your cholesterol, other cholesterols like the bad ones. Have they ever been high in the
Yeah.
past?
Yeah. 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 They were high. The last one, I think it was just over
LD?
200. Just over 200.
Okay, okay, and that's total cholesterol, right?
I believe so. Yeah. It was the whole. Yeah. It was like 210, maybe
Okay.
somewhere around there.
It depends on what the reference range is, but sometimes the reference range is 200, sometimes it's 150. If
I
it's
think the
200,
reference range was 200 because I remember it was just above it.
oh, then that's not bad at all. You could have just had a big meal the night before.
Oh, okay. Well, let's check it because,
Yeah, we
I'm
will for sure.
I'm getting old, girl.
Okay, any other symptoms you can think of?
Um, I struggle with weight, obviously, especially since my late 40s, since I started, perimenopause coming into menopause.
Yeah,
So weight is an issue and it's really a struggle. I have lack of care.
like lack of care, like
I
professional
don't
care,
give up.
or they just don't care. Okay, yeah,
Yeah,
that
like I have ambitions to do something, and then I just I'm just like it's like tired, but in my bones,
yeah, yeah,
right? It's not. Yeah, it's just tired. It's like I'm just not as like let's go.
yeah,
I need help with that, right? Like I need outside interventions to make me, like I need a quad shot of espresso to get fired up or whatever. You know what I mean? Like there's just something in the bones. It's
yep.
in the bones.
I feel like this is all related to hormones.
Yeah.
Because if you can't balance those hormones, if your hormones are completely depleted, I'm talking the estrogen, progesterone, DHEA, those are completely depleted, then you are not feeling your normal self that you did when you were 30.
Right.
At 30, we're usually really even, maybe not you because you had PCOS, but the estrogen, progesterone was pretty even.
Right.
If your progesterone was deficient and they saw that that could cause insomnia, anxiety, stress, depression, PCOS. I'm sorry, PMDD is what I meant to say because before your period, the week before your period, if you had like overly like emotional outbursts, like feeling that way, you still technically have that type of an issue, but we're going to balance it out with bringing both your hormones up together instead of being like this
Right.
because your estrogen was so high and your progesterone was so low. So it's going to be great to see where you go with this. So our next step is going to be you drawing your blood.
Okay.
And they usually, if let's say I sent that to you today,
Okay.
be able to go draw it tomorrow morning before noon. You want, or the whatever morning you have
Fasting.
available.
You're gonna want it fasting, right?
Fasting, lots of
Hmm.
water, and before noon, because we check cortisol levels too, which could be part of the problem. We also check thyroid. A lot of those things we want before noon. Also, your testosterone peaks in the morning, and then, who wants to fast till 3 in the afternoon, right? So, it's really important to just have tons of water in your system and no food, and then it'll come back to me in about 2, 3 days, and we'll review, okay?
Okay. Okay.
Tell me, anything else you can think of, because I may have already gotten some of that history before previous, but what any surgeries that you've had except for that, removal of that one ovary?
Yeah. I had ACL replacement and meniscus repair. on my left knee when I was 43.
Okay.
And I don't
When you were
respond
43?
yeah, I don't respond well to anesthesia at all.
Oh,
So,
yeah,
it just
me
yeah,
either.
yeah, it's gross.
Um, did you end up having a little bit of, like, nausea after surgery then?
Oh, no, I did, but only because they shot me up with morphine because I didn't want morphine. I didn't want anything. But my leg was uncomfortable, like it was just so straight, and I woke up to it like, "Whoa." And I said, "I'm
Mm,
uncomfortable." But I meant like my leg in the cast or whatever it was.
no,
And they
whatever.
boom. And all of a sudden I was like, "Whoa." So, but I've had surgery before, and with the left fallopian tube, I was not nauseous. I just don't feel well, and my body doesn't like it, and you know, but I let the anesthesia know, "I'm afraid to throw up. Please give me the anti-nausea. Please make sure I don't." So, I think the nausea was the morphine on the knee surgery.
Yeah. Yeah, and the reason why you feel that way, most people don't realize anesthesia is toxic.
Yeah.
So it causes us to feel crappy for almost 3 months.
Yes.
And
Yes.
you don't even realize that's what it is because they say it's out of your system in a few days, but hair loss, skin
Mhm.
issues, all that stuff,
Feel like
happens
crap.
after surgery.
Yeah.
Have you
Yep.
have you ever heard of glutathione?
Yes. I actually I might even have some. I might even have
Glutathione.
some.
It's absolutely amazing for detoxing your body at the cellular level,
Okay.
specific the liver, because the liver takes the brunt of most toxins, so it really cleans that liver out really, really well. So
What
if
do you
ever you
recommend on what do you
what was
recommend
that?
on doing that? I'm sorry, what do you recommend on, like, what type of dosage? If
250 milligrams daily. You could take it on
okay.
a daily basis right now and keep your liver and your spleen and your just your body healthy.
Okay.
That really does help with the detox. I actually do an IV infusion for some of my patients who are detoxing off of drugs and stuff like that or alcohol, and they'll come in and they'll do one, like, every few days just to get that
Okay.
stuff out of their system, and they detox easier. So, if it helps those people, it'll definitely help with just keeping you super healthy, you know what I mean?
Good to know.
Just from the air we breathe, it's not good for us, you know what I mean?
Right, right. Yeah, no, that's great. That's good to know. Say it again?
What was that? Glutathione.
Glutathione. Okay, great.
Yeah. Okay, so I think I've got the majority of your history. I've got what your symptoms are. When we come back to review your labs, if there's anything else you can think of, you can just tell me, okay?
Okay. Yeah.
And then we'll add it to your chart. And then any other questions before we go part
No,
ways?
I'm ready to do this. Let's go. I wanna
Okay.
feel better,
All right.
darling. I
Okay.
wanna feel
I'm gonna
better.
email you that lab rec. You print it
Okay.
out and take it to Core, and it's already technically paid for, so they shouldn't charge you anything, okay?
Okay, great. Thank you.
Okay. All right, sister. It was
Alright, mamas.
wonderful talking to you,
Yeah, you
and we
too.
will talk to you later.